Podiatry is a special kind of medicine. It is all about feet. It also includes ankles and lower legs. Podiatrists are foot doctors. They help people with foot pain. They treat many foot problems, like bunions or flat feet. They help you walk better. Medical coding is like a secret language. Doctors and hospitals use it. It turns medical services into codes. Each code has a special meaning. It tells what the doctor did. It also tells what was wrong. Insurance companies use these codes. This helps them pay the doctor. Podiatry uses medical coding too. Foot doctors need these codes. The codes show the foot care given, for example, fixing a toenail or helping with a foot injury. Correct codes help doctors get paid. It is a very important skill. It needs care and attention. Learning podiatry coding is very useful. It helps the doctor's office run well. It makes sure billing is correct. This means fewer mistakes with money. Patients can also understand their bills. It is an important job in healthcare. Good coders are always needed. They help everyone in the process. There are different types of codes. One type is CPT codes. CPT means current procedural terminology. These codes are for procedures. They tell what the doctor did, for example, surgery on a toe or an injection in the foot. Each action has a CPT code. Another important type is ICD-10-CM codes. ICD means International Classification of Diseases. These codes are for diagnoses. They tell what is wrong with the patient, like a broken bone in the foot or a skin infection on the leg. Every sickness or injury has a code. This helps explain why the doctor saw the patient. Then there are HCPCS Level 2 codes. HCPCS means Healthcare Common Procedure Coding System. These codes are for supplies and some services. Think of special shoes for foot problems, or a walking boot for an injury. Crutches or special dressings also use these codes. They are not covered by CPT codes, so we use HCPCS codes for them. Sometimes codes need more details. We use modifiers for this. Modifiers are 2-character codes. They are added to CPT or HCPCS codes. They give extra information. For example, which foot was treated, or which toe had a problem. Modifiers make the coding very specific. First, you must read the doctor's notes. Read them very carefully. The notes tell the patient's story. They say what problem the patient had. They also say what the doctor did. All the clues for coding are here. Understand everything in the notes. This is the most important first step. Next, find the diagnosis codes. These are the ICD-10-CM codes. What was wrong with the patient's foot? Was it a painful bunion? Or maybe an ingrown toenail? Look for the main reason for the visit. Find the code that matches the problem. Be sure it is very specific. Then, find the procedure codes. These are CPT or HCPCS codes. What did the podiatrist do for the patient? Did they remove something from the foot? Did they give an injection for pain? Or did they provide a special shoe? Match each service to the correct code. Check your coding book carefully. Finally, check if you need modifiers. Modifiers add important extra details. Did the doctor work on the right foot? Or was it the left foot? Sometimes a service is done many times. A modifier can show this. Choose the correct modifier for the situation. Always double-check all your codes. Section 4. Podiatry Coding in Action. 2 examples. Let's look at a simple case. A patient comes to the podiatrist with a painful ingrown toenail on the right big toe. The doctor performs a nail avulsion, removing part of the nail. Now let's find the codes. ICD-10-CM code L60.0 for ingrown nail. CPT code 11730 for nail avulsion. Modifier T5 for right foot, great toe. Now, a harder case. A patient with diabetes has a small ulcer on their left heel. The doctor cleans the ulcer, called debridement, and applies a special dressing. ICD-10-CM code E11.621 for type 2 diabetes with foot ulcer. ICD-10-CM code L97.421 for non-pressure chronic ulcer of left heel. CPT code 97597 for debridement. HCPCS code for the special dressing. Section 5. Why getting podiatry codes right matters so much. Accurate coding is crucial for payment. Insurance companies use these codes. They decide payment amounts. Wrong codes mean wrong payments. Doctors might get paid too little, or claims might be denied. This means no payment at all. Correct codes ensure fair payment. They also help patients understand bills. Patients see what services they received. Insurance benefits work correctly. This avoids confusion and stress. Patients trust the clinic more. Clear billing means good patient care. It helps the clinic run smoothly. ensures steady income for staff and supplies. Accurate records track patient services, useful for managing the clinic. Shows the clinic is professional. Supports healthcare data for research. Researchers study foot health problems. They see which treatments work best. It helps improve care for everyone. Coding well is a big responsibility. It helps not just one patient, but many.